Good morning, everybody, and hopefully you can hear me. My name is Leslie Horton. I'm the director of Yavapai County Community Health Services, and I'm joined today by Josh Goldman. He's our Public Health Emergency Preparedness Coordinator, as well as Sally Slater. She is our nurse coordinator and does a lot of the coordination of vaccine planning and will be the one in charge of administering thousands of vaccines across our county. And so I appreciate you all taking the time to learn about how we plan on administering this vaccine. I'm going to explain a lot about the vaccine and hopefully answer most of your questions through the presentation. And then I'm sure you will likely have more towards the end. So let's go ahead and do the first slide, David. All right, so our vaccine timeline is rather close and approaching. And so this week, the Moderna vaccine has gotten its, or at least was voted 20-0 to be approved for its emergency use authorization through the FDA. And so last week, the Pfizer vaccine was already approved. In Maricopa County and Pima counties, they already received a large shipment of the Pfizer vaccine. And yesterday, they held their two first successful drive-through pods for getting people to pick up and get vaccinated with that Pfizer vaccine. It was decided, and I'll talk about that in a little bit as to why, to allow the more rural counties like us to use the Moderna vaccine, and that's for a variety of reasons. And so our timeline for vaccinating and distributing the vaccine is not much different from Phoenix and Tucson. We're just about a week behind. And so we are expecting that emergency use is absolutely approved. And then the shipments of that Moderna vaccine should be going out this weekend. We do intend on receiving that vaccine between next Monday and Wednesday. One of those days we will receive our shipments. We've already received some ancillary kits that help us to utilize that vaccine and know what to do with it. So we've been preparing since about July for this vaccine to arrive. And so we have some good plans in place, and we'll go through that today. So in the first priority group, this is one thing I want to explain because it's going to take us a little bit to get through these priority groups. The CDC has defined, and the state has then reviewed and made sure that individuals like teachers and childcare and other essential workers are also on priority lists for us. But our priorities for getting the vaccine out initially start with healthcare practitioners and technical occupations, healthcare support occupations, emergency medical responders, and then Walgreens and CVS have a pharmacy partner program that is going to start next week to vaccinate long-term care facilities that signed up for that program. So our initial allocation of vaccine is going to, for the most part, actually just be distributed out to our hospitals and other healthcare agencies, and so that we can get those frontline medical workers vaccinated first and foremost. And so we are going to be working with each of those healthcare practitioner teams, and the hospitals are both ready and have put their orders in for the vaccine. So then once we get into January, so I'm guessing that's going to take us a little bit here, probably a week or two, to try to get out that vaccine to healthcare providers, as well as address the ones that don't have someone on their team that can vaccinate their own, and we'll be assisting in that process to get people vaccinated. Now, in January, we're going to enter into what they're calling phase 1B and as well as phase 2. And so there's some different terminology with these, but they've pretty much put the priority groups into 3 phases. And so teachers and educators fall under the phase 1B. And so as you can see in the middle of this chart, as we get into January, we're going to try to accomplish as much as we can to get through phase 1B, and that's assisted living, independent living, and HUD housing, both staff and residents. DES group homes for the developmental disabilities, as well as their staff. Adults with high-risk medical conditions in shelters and congregate living. Law enforcement, corrections, national security members, and then education and childcare. And so as we get through these groups, we're going to need to remain flexible with our timeframes, as it may take us longer to get through certain groups, but we've got a pretty good plan in place to try to get through these as quickly as possible. And our hope is once we get into a group like education and childcare, we can set up either on-site vaccinations, or we'll set up times at our YCCHS locations or other designated locations in the community where we can hopefully vaccinate as many in your team as want that vaccine as quickly as possible. And so we are going to be setting up dates and times. We don't have those yet because we've still been waiting on that initial shipments of vaccine. We don't want to jump the gun and try to schedule too many things before we actually know our time frame. So beyond that, we have in one, I guess, phase 2, they're calling it, or 1C, we have essential workers, and those are considered our power and utility workers, our food, agricultural, packaging, distribution, grocery, restaurants, transportation and material moving, government entities, and other essential or critical trades. So teachers, education, and childcare do come before all of the other essential workers, and you can thank Governor Doug Ducey for that, since he decided that that was definitely one of his priorities, and I can appreciate that, as I definitely want to get our kids back to school just as quickly as possible. And one of the things that will help us to do that is to get a level of security and immunity amongst our teachers and faculty and staff. So go ahead, next slide, please. All right, so Arizona has a pretty thorough vaccine distribution plan. I put the link on this page too, if you want to use your free time to view the plan. But for the most part, we are distributing the vaccine as equitably as possible in Arizona. Pfizer, like I mentioned, is going to Maricopa and Pima counties. They are expected in December to get 212,550 doses. They're already a little concerned that they haven't gotten, I guess, a solid word on how quickly that allocation is coming. And so they haven't received as many as they expected. But the good news is some of the vials that they've received have between 5 and 20% more vaccine in each vial, which is going to help it to spread a little farther. But this is why we're trying to keep flexible timeframes, because we know that there's going to be some issues in the supply chain, as well as the supply is still rather limited across the nation and across the world right now. Moderna allocation, which is the one that we are expecting, is going to be given out to all 13 other counties, including us. 171,200 doses will be distributed across the other counties. Our initial allocation that we're expecting in December is 8,100. And so we know that our first shipment is going to be around 3,100, and then we will hope to receive the remainder after, shortly thereafter, within this month. Then we also have some agencies in the communities that are going to receive direct allocations from the CDC or the federal government, and those are the VA. They're expecting about 700 doses to suit and vaccinate any of the veterans that they serve that want the vaccine. I think they are either receiving those this week or next. And then the pharmacies, some of those could sign up to get direct shipments. And our statewide tribes will also get direct allocations of vaccine. So that little chart just kind of outlines the processes that the state is following and looking to make sure that we're covering all populations, and especially working through those priority populations in a rather effective and efficient way, so that we can try to get eventually to the general public, which would probably, we're expecting that to be late spring or summer before there is enough vaccine supply, and that all these priority populations are vaccinated, hopefully by the summer. So go ahead, next slide, please. All right, so Moderna vaccine, I wanted to give you a little overview of it, kind of why it's good better for rural communities, as well as some of the stats that they've seen so far in testing. Now this week, as it receives its emergency use authorization, we'll get a whole bunch more information. Right now we're working off of Pfizer vaccine. Even the image that I use here depicts a 3-week time span between vaccine shots. Moderna is actually 4 weeks. It's 28 days apart between the first shot and the second. But most of the information that we've been basing planning off of has been for Pfizer, because they were the quickest to get information out to us on this new type of mRNA shot. But what we know of Moderna is that they have had a 94.1% efficacy rate. So it does work in 94.1% of the time to boost and bolster someone's immunity against COVID-19. It was tried on 30,000 people. It is not allowed on individuals under the age of 18. The side effects of vaccines, and some vaccines similar to shingles shots and other vaccines that are a little rough, is that it does hurt. I've heard upon injection, so that's something that people can prepare for mentally and be ready for that. But also there are some typical side effects that come along with getting this vaccine. They're more prevalent or more common after the second shot versus the first shot. So sometimes the first shot's a little easier to take, second one might be a little tougher. But those include fever, headache, and fatigue, and then a few others that I'll go over in a minute. They were, like it says here, they're common and unpleasant, but not dangerous. And, some of the reasons why we are receiving Moderna versus Pfizer is that the Pfizer vaccine requires ultra low cold storage of -80 degrees Fahrenheit. And so most counties like us don't have massive storage facilities with ultra low cold. And so Pfizer also is required to be used within 5 to 10 days once it's outside of the ultra low cold and on dry ice. So Moderna is a little different in that it does not have to be stored at ultra low cold. It can be stored and refrigerated up to 30 days, which makes it, for us to get it out to every corner of our county and to all of our providers, definitely a little more easy to transport, to handle, and store even. So Moderna is also shipped in much smaller supplies. It's shipped in 100 dose boxes, whereas Pfizer only comes in 975 dose boxes. So that makes a big difference, because our hospitals are truly the only ones that could probably utilize the 975 dose boxes efficiently enough to get through that supply in the time frame allotted. The Moderna allows us some wiggle room and time to use it, and far fewer doses per box, which makes it for easier handling. And then the advantage of Moderna is, let's see, I guess, I already covered that, is the not having the ultra low cold and the longer refrigeration times. So the FDA has already come out and made note that there have been a few select cases of extreme allergic reactions. And so with that they are suggesting that people that have had a severe allergic reaction, this isn't hay fever or seasonal allergies, this is like an anaphylactic allergic reaction to a food or an exposure of some sort. And they're requesting that people that have had that before to anything hold off on getting the vaccine until they can identify which component in the vaccine has caused that. Like I said, it's only been a few very select, I think 3 people now in our country, but we want to make sure that people are aware that if they have had allergies before, especially if it's to a vaccine, that they hold off and wait until we have a little more information on those allergic reactions. So pregnant women can take the vaccine. It can cause a fever, but they are saying that it does not, as far as they've seen, and I'm sure it's been limited testing on pregnant women, but they are seeing that it doesn't, it's an mRNA, not a live vaccine, and it's not passing over into a fetus or a baby in the womb. And so that's good news. If a pregnant woman wants the vaccine, she can receive it, but expect probably to have a little fever afterwards. And then immunocompromised individuals, such as those with HIV or other immunocompromising health issues, can be vaccinated. There is just some unknowns about how long the vaccine will bolster their immunity. It may be a shorter term duration of immunity than other healthier individuals. And so they do recommend it for people with compromised immune systems, but it just may have a lesser reaction than for others. Next slide, please. All right, so I've included this draft guidance because I think it provides some good information on what to expect. Maricopa County made this as they looked over the side effects that could be expected with the Pfizer and Moderna vaccines. And so this kind of explains that how to expect the side effects to happen, but also when to seek COVID-19 testing if you have symptoms around that same time of the vaccine. And so the vaccine can, like I mentioned, cause some concerning side effects, but they're not long-term side effects. So these are things like fever, fatigue, headache, chills, myalgia, and arthralgia, which are muscle and joint pain or soreness. And they're more common, those side effects are more common in people 18 to 55, which is probably the majority of our workforce. And we're also more common after the second dose than the first, like I mentioned. However, these symptoms really should not last longer than 2 days. And so if you kind of read down here, it talks about, how those side effects can present themselves, but also that they usually, and most people tested with in the trial periods, these side effects last less than 24 hours. In rare cases, up to 48 hours, but should not last more than 2 days. So that's important to consider if you're going to consider vaccinating your entire workforce, or if quite a few people on your team want the vaccine, to realize that you might have a couple days there where people are not going to feel great and should maybe plan accordingly, either stagger vaccine days or maybe do it on a Thursday or a Friday prior to the weekend, or something that would allow for some days there to recover. Now, just because you've been vaccinated doesn't mean you have immediate immunity. And so that first shot generally starts, and over the course of a couple weeks, starts building up your immune system and bolstering it against COVID-19. But that doesn't mean that you can't get infected with active COVID-19 infection at that time, or even just before getting the vaccine. So you still need to kind of watch your staff and yourself and those that have been vaccinated for active infection. And so that's where you kind of look at those symptoms and say, well, if it's, these basic symptoms that last a day or two, that's one thing. But if your symptoms like a fever or other symptoms persist for more than 2 days, then you probably need to seek out testing and exclude that person from work until they're feeling better, until you find out if it's COVID-19 or not. And so when you get that first vaccine, usually that gives you about, after a couple of weeks, it's going to give you about 60 to 80% of your immunity. And then the second shot, after 28 days or more, it's a minimum of 28 days generally, that when you get that second shot, that will kind of close in the gap of immunity for you. So that second shot brings up your immunity to COVID-19 to nearly 100% or 94.1%. And yet In that time frame, though, you still need to watch out for active COVID-19 infection symptoms. So you're not off the hook just because you got the first shot or even the second one. You need to always keep an eye on symptoms, make sure you're monitoring it, and you could still have, you can still spread COVID-19 to others if you have an active infection. One of the things that they've said too is that the vaccine has not caused people to lose their sense of taste and smell, which is pretty a telltale marker of this one. Not always, it doesn't always occur, but if you get the vaccine and you have some other symptoms, or if you lose your sense of taste and smell, that's a good sign that it might be an active COVID-19 infection. So just wanted to run through that. Also, when you're looking at fevers, as we have been for the past several months with COVID, a fever with this as an active infection oftentimes provokes a fever over 100.4 degrees Fahrenheit. So keep it in mind that you still need to be a little bit aware of those symptoms and how long they last, and making sure that you seek out testing if needed. So next slide, please. All right, I think I'm going to hand this over to Josh Goldman. Thank you.
Thank you, Leslie. So in order to support us in planning and preparing and coordinating vaccinating of phase 1B, yourselves included, we're going to need a little help from you. A link will be going out later this afternoon, and we're going to be asking some questions. We're going to be looking for points of contacts for all agencies, so name, phone number, all that standard information, and then more or less just a rough estimate of number of people within your agency, be it school, district, whatever the case is, on how many staff and faculty you expect to be vaccinated. Once we are able to get this information, we can compile it and work with our local partners as well as our internal vaccinators to coordinate, like Leslie said, offsite or onsite vaccination clinics to get that phase 1B population vaccinated. It's important to remember that this vaccine is optional, and it is also free of cost to all Arizonans. Governor Doug Ducey put down that no Arizonan will be charged for the vaccine at all. And people who have had the virus can still be vaccinated. So as long as you have recovered and you are healthy from the COVID-19 virus, you can receive the vaccination. But again, look for that link later this afternoon so we can start planning and preparing to get vaccinations out and rolling. Thank you. Oh, one more thing, I apologize. So as Leslie mentioned a few slides back with the side effects, they are common. The allergic reactions are rare, but the side effects from the vaccination are common and can be harsh at times. So it's important to stagger your vaccinations of staff if possible. You don't want to vaccinate your entire workforce and then have your entire workforce down for a couple days or a week due to harsh side effects. So please keep that in mind when planning your vaccinations. Thank you.
That next slide.
And so volunteer recruitment, we've received a lot of people reaching out at the health department, and you may have in your agency as well, to help volunteer in whatever facet that may be with the COVID-19 pandemic, vaccinations, and so on. So we are directing everyone to the state volunteer management system. It's called ESAR VIP. It's the Emergency System for Advanced Registration of Volunteer Health Professionals. Very short, nice, clean acronym. And what that is, go to the website. You see down at the bottom, the link, azhealth.gov/volunteer. Terry Farnetti, our PIO, also put out some information in her update yesterday, so you can find that on our website. And you can go there if you are interested in volunteering. The benefit of using the state volunteer system is it's a statewide pool. So if we have Yavapai County volunteers specifically that aren't being utilized, they can be used in other counties and vice versa. We can take it the other way. If we are in need of more volunteers in, say, Maricopa or Coconino County, as volunteers not being utilized, we can pull from that big pool together. So please spread that information around if anyone is interested in volunteering, and for yourself as well. Next slide, please.
All right, so let's go into your questions. It looks like we have a number of questions in the chat, and thank you, Josh, for that good information, and hopefully we can answer any of the questions that have come up. We have Sally Slater on the line here too to help us with some of the medical questions that you might have, and so let's see, do we want to work through those? Sally, are you on the line now?
Do you want me to? Would you like me to ask the questions?
That would be great.
I know Sally was seeing a patient. I think she had to step away for a moment.
Okay, well, hopefully we can answer the ones that we can, and then we will see.
The first question is the first two questions are about allergies. Should people who are allergic, should they be vaccinated, or can people transmit a virus to their family and friends after they've been fully vaccinated? Oh.
Those are good questions. With the peanuts, if someone has had a severe allergic reaction to anything at this point in time, we're recommending waiting. If someone waits for the vaccine because of an allergy, and then we find out that it's a specific allergy, then we can go ahead and try to get that person back into line for a vaccine just as soon as possible. But peanuts, I'm not absolutely sure. There may be more information in the packaging materials with the Moderna vaccine when it's released this week. So hopefully by today or Monday, we should have a little bit more information on that. And Sally might be able to expand on that if she gets back. In terms of the active virus to family and friends, the Moderna vaccine is 94.1% effective. So that is where, I would recommend if people have the vaccine, it should give you almost nearly 100% immunity. However, if you're one of those individuals who could possibly still have some gaps in the immunity after 2 shots, you do need to kind of be aware of symptoms as they arise. And so still, if you come down with real achiness, loss of taste and smell, other fever and other things that last over 2 days, or outside of the period of time when you've just gotten those vaccines, those symptoms should be quick thereafter getting the vaccines. So if things crop up, we have flu circulating and other things also, but it's good to maybe seek out testing so that you don't pass that along to family and friends. The mRNA vaccines will not give you the virus. And so it's not a live virus. And so it won't actually give you an active infection, but that's not to say you didn't have exposure before or during that period of time that you are getting your immune system boosted.
The next question is about penicillin. What if you're allergic to it?
I would say similarly, I'll try to get Sally to answer to that, but I would say too, yeah, if you've had a severe allergic reaction to penicillin, same thing is to probably wait just a little while to figure out what this component of this vaccine that is causing people severe allergic reactions. Like I said, it's very rare, but I don't necessarily want anyone to have to undergo a severe allergic reaction with it.
And additionally, too, I know Sally mentioned that the severe allergy or allergic reactions to the vaccine are directly related to the ingredients of the vaccine itself. So if I'm not sure if penicillin is an ingredient of the vaccine, but basically if you're allergic to any of the ingredients, then that can lead to severe allergic reactions.
We have a question about, is education considered K-12 or does that include higher education?
All of the above. So it's K-12, but also higher education, as well as childcare.
How long is the vaccine expected to provide immunity?
That's a good question. That's one that I have not been able to answer yet. And I don't know that it's absolutely known yet because this has only been tested for several months. We know that with active COVID-19 infection, it oftentimes bolsters antibodies, which give you a natural level of immunity for at least 4 to 5 months or more. But some people do see a decrease in their antibody resistance for 4 to 5 to 6 months of having an actual COVID-19 infection and antibodies. And so with the vaccine, I don't think that they've come out and said exactly how long it will bolster your immunity when it's only been tested for several months now.
So Clint Idwell asks, we have lots of healthcare students. Could they be vaccinated to allow them to volunteer safely? Nurses, EMS, et cetera.
As long as they're over the age of 18, yes.
And someone is asking if the webinar is being recorded, and yes, it is being recorded and will be posted on our website. And there's a question here about let's see where to go. Your questions. Will vaccines be given in outlying areas or do people need to travel to Prescott?
We're going to do our best to suit people and get them the vaccine where they are or in close proximity so that people aren't having to travel a long ways. We are directing parts of our shipments to Cottonwood and parts to Prescott. And then we are going to arrange for figuring out if we can do on-site. What Sally has said is that it's going to depend on the ease of handling of the vaccine. And therefore, if the vaccine proves to be very fragile and difficult to transport, we're going to have to do it on our YCCHS locations in Cottonwood and Prescott. If it's something that becomes, very simple and easy to transport, we can do rural clinics like we do for flu shots and other things. And so we're going to learn a lot when we start receiving this and figure out what we're able to do and not. Hopefully we can set up convenient dates and times and locations for your groups.
We have a question. Is the vaccine advised for use post-exposure prophylactically?
Sally, are you back now? I saw that she's not muted anymore, at least, but maybe she is. So in terms of post-exposure to COVID, people shouldn't get the vaccine if they have an active infection. So that's one thing to be aware of. If you have active COVID-19, don't get vaccinated right then. But you can go ahead and get the vaccine even if you've already had COVID-19 active infection.
That looks like we've answered them. The questions.
All right. Is there any other?
Yeah. Just to follow up to question on students, if over the age of 18, David, can any enrolled in college courses receive the vaccine or only students in healthcare, first responder programs?
That's a good question. I think that the students in the general population of a school are going to have to wait until the either the Congress, if they live in dorms and stuff, I think they might be able to get away with the end of the priority groups, which is the 1C, priority 1Cs are adults living in congregate settings and others that may be higher risk, but for the most part, college students are a very even though they spread it readily, they're a very low risk for complications and others. So I would say those healthcare students that actually could volunteer and help to provide, services to others or help with vaccinating others, that would be definitely given a higher priority than the general population. Those would probably come in later with general population vaccinations.
When will we be notified when the vaccinations become available?
And Leslie, real quick, sorry if I could jump in on that last question. Just to add a little more kind of clarity to that, just want to reiterate that phase 1B for childcare and education is for educators. So it is not for the student body, be it college or children. Again, Moderna is only for 18 and over. And then to reiterate, Leslie said, in phase 1C, we will be looking at adults in congregate settings, so more of your college student population. But then K through 12 students aren't even eligible for the vaccine right now. So again, phase 1B for education and childcare is for educators, faculty, and staff specifically.
So again, that was how will we be notified when the vaccines become available? The vaccination.
We are going to be communicating, and one thing to be aware of is that we won't be communicating publicly where vaccine clinics are going to be held for specific priority populations. We're going to, we don't want general public showing up to these. And so when we have enough supply, and we'll try to keep people aware of kind of where we're at on the priority lists, working through those populations. But once we get enough adequate supply for certain areas of the population, we will be reaching out to schedule vaccine clinics with a whole school, a whole district, or some agencies, if it's childcare agencies, probably setting up a location and inviting people. So one of the things that we do need is from you, and Josh might be able to expand on this, but is a estimate of how many amongst your staff want the vaccine. And so it's optional for everyone. That is something that to keep in mind. It's not a mandatory vaccine, but if people want it, we want to make sure that we have enough supply to suit their needs. And so we're going to be setting up a portal on our website that'll be a COVID-19 vaccine portal. And people can email us the contact person for their agency or their school and how many people in that group want the vaccine so that we can make sure that we schedule a vaccine clinic for you.
We have a question about the recording of this webinar. The recording there'll be a link to it on our website later, probably for early next week. We have one other question. Are allergic reactions life-threatening or responsive to non-hospital intervention?
The allergic reactions that have been experienced so far have required hospitalization in the 3 that I know of. And so it did not. Sally, are you on yet?
She's still with the patient.
Okay. With those, though, from the allergic reactions that have been experienced so far, no one has died, but they did require hospitalization and have recovered since.
And it's very nice. Clint, Ewell said, please let us know if there's in any way Yavapai College can help you in this next phase. Thank you very much.
That has actually been a topic of conversation, is to see, if student nurses can help us. And we are looking, as Josh mentioned, that volunteer sign up would be great if people want to be a part of these vaccine clinics. We definitely will be needing as much help as we can round up. And so any help that you can offer would be great. And we are going to be looking for possibly some locations as well for community vaccine clinics. In the past, when we had H1N1, we used large gymnasiums and other locations to help. Here's Sally. So we've used other locations, and we may be reaching out to you, the schools, especially if you have breaks in sessions or other times when we can use a gymnasium to physically distance people and be able to work people through a system of vaccination. And then there's a monitoring shortly thereafter if someone gets a shot, that we have to kind of watch people and make sure that they're feeling all right. So Sally, there was a bunch of questions about the allergies that I thought you might be able to answer better than I can.
All right, allergies. So the majority of the information on the allergies we have comes from the Pfizer vaccine at this point, since I don't have the EUA yet for the Moderna. But let me grab our algorithm. Okay. So a history of food, pet, insect, venom, environmental, and latex allergies, history of allergy to oral medications, non-serious allergy to vaccines or other injectables. The indication is to proceed with the vaccine at that point. If there is a history of a severe allergic reaction like anaphylaxis to another vaccine, any other vaccine, or a history of severe allergic reaction to an injectable medication, that is a precaution. So that's a discussion that you need to have with your healthcare provider about whether or not the risk outweighs the benefit. And then if there's a history of a severe allergic reaction to any component of the vaccine itself, that is an absolute contraindication and we would not give the vaccine.
People had asked specifically about penicillin and peanuts.
So with the penicillin, if it is a severe allergic reaction like anaphylaxis, then that is definitely, it's a precaution. So we need to have a serious discussion with those people. Like at this point, there's no guidance from Pfizer or the CDC or ADHS saying if you have a severe penicillin allergy, don't give it. But we might want to err on the side of caution with that. And peanuts, it's a food allergy, so it's listed in the algorithm that it is okay to give the vaccine.
Thank you, Sally. Is there any other questions that have popped up since?
There's one that says, does the Moderna website have a list of ingredients that may cause allergy?
Let me see if I can. This would take me longer than I have right now to find all of the ingredients for Moderna's vaccine. I will have them very soon, given that the EUA was approved and I get that the authorization fact sheet quickly. But I don't have the list of ingredients right now.
I'd recommend to people as this week proceeds, and I realize it's Friday, but since that emergency use authorization is going through and it's going to be starting to ship, the information should become readily available to us online, as well as in our department. We will get information about the vaccine and be able to answer questions a little better. If you have specific questions and you can't find the answer online, you can call us. We put on the presentation too, we have a hotline that is 442-5103. And our phone operators that answer those calls, they can always seek out the answers from the rest of us if they can't answer your question immediately. And so There's going to be a lot that we're going to learn about this vaccine specifically in the next coming days before we receive it. And so we should have more answers, and a lot will be available online. It just it waits until that emergency use authorization is approved. And then all of a sudden that information is posted about the vaccine. So I do recommend, if you're considering the vaccine, to do your own research as well and look up the information available and see what you can learn, especially if you do have allergies or any other concerns that we haven't been able to answer specifically here. Is there any other questions on here that have come up?
I don't see any more questions.
Right. Well, I just want to thank everybody for taking the time to learn about our processes. I realize I don't have concrete dates and times yet for vaccine clinics, but we will. As soon as we know, we will get in touch and let you all know when and where to be if you want the vaccine. It helps us in the meanwhile if you can find out how many in your school or in your agency would like to have the vaccine, so that we can get a good head count before meeting with you to vaccinate. And so we will be in touch, and we appreciate your time today. We will post this online at our website, yavapai.us/CHS. If people missed it, the live version, they can pick up the recorded version after the fact. So thank you very much. I look forward to working with you in the coming weeks and months as we get this vaccine out to all of our educators and childcare workers. And as always, we deeply appreciate everything that you do to care for and educate our children and our populations in Yavapai County. So thank you very much, and we will talk to you soon.